Hi everyone, my name's Sydney. I am a doctor of physical therapy here at Loudoun Sports Therapy Center, and today we're going to be talking about the three main causes of low back pain. So the first one, and probably the most common cause of low back pain that we see here, is going to be stenosis, degenerative disc disease, or arthritis in the spine. So just to make some sense of that for you, what happens in the low back when you have stenotic changes or things that are related to aging where the space between your vertebrae starts to narrow is called stenosis. So what happens is the disc height will start to decrease, which decreases the space for your nerves to come out, and that's what transmits those nerve signals down your leg. People will complain about numbness, tingling, anything going down the leg is most likely a cause of something impinging on that space between the two vertebrae. So with stenosis, with those spaces being narrowed, you're going to get a pain signal because that nerve is being pinched on. So for a herniated disc, it's pretty much the same principle. Something is pinching on the nerve. In this case, instead of it being from a narrowing of degenerative changes, it's more so from a disc protruding into that space. So the inside of your disc is a really good cushion for force transmission and protecting your lumbar spine. So what can happen is the inside of that disc can push outwards into the foramen, which is where the nerve comes out. So you can see here, this little red thing is a disc herniation. You can see how that takes up some space where the nerve should be coming out. So that disc can be pushing on the nerve and can transmit pain signals also down your leg or into your back. And then another cause of low back pain can be instability. So your back isn't the most mobile part of your body, but sometimes it can be made almost too mobile to the point where you're straining the muscles and ligaments in your back as a result of a lack of core strength, which can come from lack of abdominal strength, glute strength, and back strength, which can all put too much pressure through the actual joints themselves, which can cause an overuse type of injury like a back strain.